330,000 patients die each year from prescription drugs in the US and Europe. Do the math. What does that turn out to be per decade? 330,000 per year sounds like approaching 3.5 million to you. Just move the decimal points. Quote, the drugs, also cause an epidemic of about 20 times more, that would be about 6.6 million per year, hospitalizations, as well as falls, road accidents, and about 80 million per year, medically minor problems such as pains, discomforts, and dysfunctions that hobble productivity or the ability to care for others. So you've heard a great deal now about the secret House memo and what it contains and what it might contain and what happens if it's released and so forth and so on. Well, there's another secret memo, which I call, for purposes of discussion, the secret medical memo. This is a blockbuster. But the funny thing about it is that it's not secret at all. It's open information. The information has already been published in open journals. It's there. It accuses, by implication, one of the biggest agencies of the federal government, several actually, of mass murder. And yet nothing has happened. The medical memo. Story number 2. I'm going to read from my piece today, Why the FDA Should Be Charged with Murder. If you worked for a federal agency that was killing people at the rate of 100,000 a year, every year like clockwork, and if you knew it, wouldn't you feel compelled to say or do something about it? I think I can assure that 99.9999% of the people listening to this program would say, you bet, absolutely. And yet the people who are committing these crimes do not feel that way at all. They are not like you or me. They are different. Smoking guns on the memo. Open secrets in the literature. I don't usually make the citations on air, but I'm going to just to show you that it's there. BMJ, British Medical Journal, online, June 7th, 2012. Author, Gene Lenzer. Refers to a report by the Institute for Safe Medication Practices, quote, the report calculated that in 2011, prescription drugs were associated with 2 to 4 million people in the U.S. experiencing, quote, serious, disabling, or fatal injuries, including 128,000 deaths. Prescription drugs associated with that in 2011. The report called this, quote, one of the most significant perils to humans resulting from human activity, end quote. It's quite a smoking gun, wouldn't you say? And the final dagger, the report was compiled by outside researchers who went into the FDA's own database of serious adverse medical drug events, otherwise known as death and destruction. Now, therefore, you can't say that the FDA, the Food and Drug Administration, was unaware of all of this. Of course, they have been aware of all of this. In fact, they are the agency, the only agency in America that approve medical drugs for public use. If you don't get their seal of approval, you can't sell your drugs in America. They approve as safe and effective. 128,000 deaths a year from the drugs they approve. We'll have more after the break. This is Jon Rappoport sitting in for Alex in the fourth hour at InfoWars. So let me continue now with the secret medical memo, which is not secret at all because it's been out in the open all this time. For some reason, the mainstream press just doesn't report on it. Wow, what a shock, huh? And for some reason, the federal government doesn't do anything about it, even though they're responsible for it. What a shock, right? And isn't it interesting that the medical destruction that I'm talking about here is part and parcel of a cartel, the medical cartel, that is one of the strongest, if not the strongest arm of that movement called globalism. Because if you are going, and I never get tired of saying this, to take over a planet, you need to find a way to weaken the enemy from within, to confuse, disorient, debilitate, destroy, weaken. And that's what the effects of all of these medical drugs that I'm talking about are in the secret medical memo. So let's go to the next citation. Dr. Barbara Starfield, July 26, 2000, Journal of the American Medical Association. She was at the time a revered public health expert at the Johns Hopkins School of Public Health. Mainstream credentials up and down the line. I like to quote these sources. Why? I understand that independent researchers peg medical destruction even higher than here, quite a bit higher. But when I quote mainstream, meticulous medical sources, the government can no longer deny and say, well, it's just people on the fringe. No, they're not. They're people in the heart of the establishment who blew the whistle. Dr. Barbara Starfield, July 26, 2000, Journal of the American Medical Association. Her conclusion in a review called Is U.S. Health Really the Best in the World? That's the citation. The medical system in the U.S., FDA-approved pharmaceutical drugs kill 106,000 people a year in the U.S., or 1 million people per decade. That's called destruction. Serious destruction. So what's supposed to happen in order to get the FDA to do something, or to get a sitting president to simply say, here are the crimes, we are going to fire everybody there, fumigate the buildings, and start over? Because this is an ongoing RICO murder machine. That's what it is. Do people have to take the corpses of their families, the 100,000 a year, and drag them to the door of the FDA and say, you approved the drugs that killed my mother, father, brother, sister, cousin, child? Is that what it takes? Maybe. Maybe. Now, as I write in this piece, if instead of these medical drugs killing people, suppose the 100,000 deaths per year were led by ginkgo, ginseng, vitamin D, niacin, raw milk, what do you think would happen? I'll tell you what would happen. SEALs, Delta Force, SWAT teams, snipers, Predator drones, tanks, and infantry would be lining up and hovering outside every health food store and nutritional supplement company in America. That's what would happen. If instead of virtually zero deaths from any of those or any other nutritional supplements, we're talking about 100,000 at minimum, a conservative estimate, killed by FDA-approved, correctly prescribed medicines in America every year. Every year. Okay, You think that's all? No, there's more. There's more. There's more to the secret medical memo. And I'll give you the quotes first, and then I'll give you the source. Appropriately prescribed prescription drugs are the fourth leading cause of death. About 330,000 patients die each year from prescription drugs in the U.S. and Europe. Listening, Europe? I know we've got lots of listeners there. The drugs, cause an epidemic of about 20 times more. That would be 6.6 million per year. Hospitalizations, as well as falls, road accidents, and about 80 million per year. Medically minor problems such as pains, discomforts, and dysfunctions that hobble productivity or the ability to care for others. That's not minor. Deaths from over-medication, errors, and self-medication would increase these figures. In other words, and now I'm talking, the 330,000 deaths per year, the 6.6 million hospitalizations per year, and the 80 million medically minor problems per year, all of this stems from correctly prescribed medicines. And these quotes come from the American Sociological Association publication called Footnotes in its November 2014 issue. The article is The Epidemic of Sickness and Death from Prescription Drugs. The author is Donald W. Light. Donald W. Light is a professor of medical and economic sociology, a founding fellow of the Center for Bioethics at the University of Pennsylvania. In 2013, he was a fellow at the Edmund J. Safra Center for Ethics at Harvard. He is a Loki visiting professor at Stanford University and a fellow of the Royal Society of Medicine. In other words, this guy has mainstream credentials up and down the line as far as you want to go. And that's what he's saying. Those are the deaths and destruction numbers of the medical cartel in the U.S. and Europe. And he, or any of the other sources I've just quoted, none of them are talking about vaccines. They are just talking about medical drugs. More when we come back from the break. Jon Rappoport sitting in for Alex.
Introducing Cellforce by InfoWars Life. Cellforce focuses on mitochondria efficiency and protection. Mitochondria produce over 95% of your energy. They are your body's cellular engines. Cellforce helps promote your cellular energy production by supporting mitochondria, much like a cellular engine overhaul, because when your mitochondria don't run at 100% efficiency, then they start producing reactive oxygen species. Top scientists agree that aging is most likely caused by cellular damage, resulting from these reactive oxygen species. The antioxidants found in Cellforce are some of the most powerful available on the market. The stronger the antioxidant, the better its ability to scavenge for these reactive oxygen species and other free radicals. Boost, protect, and adapt with Cellforce from InfoWars Life. Head to InfoWarsLife.com or call 1-888-253-3139.
I just want to repeat a few figures here. This is the last citation that I gave you from Donald Light. The drugs, appropriately prescribed, 330,000 patients die each year from prescription drugs in the U.S. and Europe. Do the math. What does that turn out to be per decade? 330,000 per year. Sounds like approaching 3.5 million to you. Just move the decimal points. Quote, the drugs, also cause an epidemic of about 20 times more. That would be about 6.6 million per year. Hospitalizations, as well as falls, road accidents, and about 80 million per year. Medically minor problems such as pains, discomforts, and dysfunctions that hobble productivity or the ability to care for others. That's like a roadmap to how do you destroy a country or a continent? Let's see, how can we do this? Well, we can say it's medicine. I mean, we've already invested billions in promotion, PR, and propaganda to assure the public that the medical people are only doing good and doing better at doing good all the time, that's all that's happening in the medical cartel. So we can simply piggyback on that. And we just say that we are building a better world. Well, in fact, and here we would be listening in at the highest levels of conversation, we are actually infiltrating all of these countries. And as you can see by these numbers, wreaking havoc and destruction and death and maiming and turmoil, emotional loss, and so on and so forth on a scale that is just absolutely unbelievable under the noses of the public, the press, the government, the what have you, everybody. And it's being completely ignored, and yet it's right out in the open. And we would even publish occasionally articles, reviews that would indicate what the story is, that just disappear and go away. That's what's happening. That's what's happening. That's what prompts some people to say the biggest secrets are out in the open. So the secret medical memo that I just revealed to you, as I said, is from open sources, right out there, in the literature, in the mainstream literature. Didn't have to go down into some subterranean cavern with goblins and present some kind of a amulet, secret sign to get the dusty volumes from past centuries. No. Medical journals, sociological journal. It's right out there, right there. Majority of people look at that and they say, well, I know what I just read, I think, but of course, couldn't be true, or I must have misread that, or I don't even want to think about what I just read. Imagine a doctor reading this, right? You know, he's in the brotherhood. He's in the society of Hippocrates from ancient times. First, do no harm. And he reads this 330,000 deaths from approved, correctly prescribed medical drugs in the U.S. and Europe every year, and millions more maimings and You know, I didn't. He's going to say, I never saw it, never read it, never heard of it. That's how secret it can become. You just hold it up and say, here it is. And people go, what happened? I don't know. Let's, what's on television? No, here it is. That's the secret medical memo. Now, if you want something to do, imagine what might happen if by, say, next week, 1 million more people than right now knew the facts that I just presented to you. If you participated in getting the information that I'm just giving you right here out in the open, and 1 million more people became aware of it, and some fraction of those million would pass that on to others, and that ripple would keep on going and going and going and going. And then the next time it's brought up, the same thing, and another 1 million people or so would become aware of it. And of course, some people say, well, it doesn't matter if they're, oh yeah, it does matter. It does matter. Don't be so cynical. It does matter. How do you think we got to where we are now? Because people are waking up. How do you think it happened that the major media are in such chaos and disarray and so desperate? Do you think that was just a ploy on their part? Let's pretend that we're completely insane for the next year or two. There's a meeting in CNN. I've got a great idea, says Jeff Zucker, the head of CNN. We're all going to pretend that we're insane, and then people will say, these people are out of their minds. I'm not going to watch them anymore. No. All this happens because people get out the information and other people understand it. And they go to true sources and they desert the fake sources. This is real. This is not some dream, an illusion. This is happening now. So I've just given you the secret info of the secret medical memo. Why not get it out there? Why not let people know what's actually happening? In the words of mainstream medical doctors, researchers, investigators, analysts, those are the people I've been quoting here. Those are the people I've been quoting. Why not get that information out? I've been writing about it for a long time. It's there. It's there in the Journal of the American Medical Association. It's there in other journals, British Medical Journal. Let's have a field day with it. Let's expose this arm of the globalist takeover for what it is. The infiltration of societies in order to debilitate, destroy, and weaken and confuse the people. And some people say, well, that's just an accident, you see. It's not on purpose. Okay, you want to say that? But what happens if the medical professionals, the medical leaders, the medical bureaucrats, the medical chiefs in charge become aware of this accident and do nothing about it? Not just for a day or a week or a month or a year, but decades, they do nothing about it. What does that tell you? They know it and they do nothing. Where did I start all this? I said, suppose you were the head of this agency that was approving as safe and effective medical drugs year after year after year that were killing like clockwork 100,000 people a year or 1 million people a decade, and you became aware of it. What would you do? Well, you know what you would do. But the people who actually are in charge are aware and they have done nothing. And that tells you that they're guilty as charged, and they continue to be a protection racket for murder and destruction. What else would you call it? Try to tap dance around this if you can. Try to find a way to exonerate them and excuse them. You can't. Good to talk with you. See you next time. Jon Rappoport for InfoWars.